Welcome to a new episode of the Urology Consultation. In this episode, we will cover a common urological presentation that many patients, especially women, suffer from, which is recurrent urinary tract infections, or UTIs. UTIs are episodes of acute simple cystitis. Typical symptoms include burning sensation when passing urine, going to the toilet often, urgency and suprapubic pain.
What are the risk factors for recurrent UTIs?
Risk factors for recurrent cystitis include frequent sexual intercourse, use of spermicides, and mechanical factors that impede bladder emptying. Like the presence of a cystocele, which is a prolapsed bladder, this is felt as a bulge in the anterior vaginal wall, which can lead to an incomplete emptying of the bladder, contributing to the infections. Women with recurrent cystitis also appear to have increased susceptibility to vaginal colonization with uropathogens, even during asymptomatic periods. This susceptibility appears to partially result from a greater propensity for uropathogenic coliforms to adhere to the uroepithelial cells of such women.
What are the initial preventive strategies for women with recurrent cystitis?
We start with non-antimicrobial preventive strategies. Increasing fluid intake can reduce the risk of recurrence. We suggest that women with recurrent cystitis generally target 2 to 3 liters of fluid intake daily. Although other behavioral approaches like avoiding spermicides and postcoital voiding have not been adequately studied, these are reasonable approaches to try to reduce cystitis risk. For postmenopausal women with recurrent cystitis, we suggest vaginal estrogen. There are several formulations. We typically refer patients to their gynecologists to assess cancer risk-related safety and optimal dosing.
Are there any additional interventions for frequent recurrences?
For women with frequently recurrent cystitis who are interested in additional preventive interventions, we suggest the antibiotic-sparing strategies of methenamine hippurate or cranberry products rather than antibiotic prophylaxis.
How does methenamine hippurate work, and is it as good as antibiotics?
Methenamine hippurate is an oral antiseptic that works by converting to formaldehyde in acidic urine to sterilize the urine and prevent urinary tract infections.
What about antibiotic prophylaxis?
Postcoital prophylaxis can be used for women whose cystitis is temporarily associated with sex, and continuous prophylaxis is used for other women. The choice of antibiotic should be based upon the susceptibility patterns of the strains causing the patient's previous cystitis. However, prolonged use of antibiotics is discouraged to prevent the development of bacterial resistance.
Thank you for watching this video, and stay tuned for future videos. If you liked the content of this video, don't forget to share, like and subscribe to help grow the channel.